Breastfeeding your baby will give them the best possible start, but it's not something that all mums instinctively know how to do. So we've gathered together some hints and tips to help you get started, and they've all been tried and tested by other mums. Don't worry or get too nervous if you find it tricky at first, because most problems can be overcome, and it is worth persevering because breastfeeding has great benefits for both you and your baby. So this is Emma and her baby son Riley, and together we're going to go through some useful tips to help get you started breastfeeding with the best of them. So first of all, make sure that you're sitting comfortably in a comfortable chair with your back well supported. You might want to try a cushion just to make sure that you feel comfortable. And then turn your baby in to face your body, trying to keep his head and his shoulders and his back all in a straight line. So then you want to line up his nose with your nipple and maybe give their mouth a little nudge with it if they don't latch on immediately. So when your baby's mouth is open, then it's time to bring your baby into your breast, not the other way round. And you'll know if your baby's latched on well if their bottom lip's curled back and the only visible area of your areola, which is the dark skin around your nipple, is above the top lip. And it's a good idea just to listen out for the sound of them swallowing as well, which tells you that they're enjoying their feed very much, which Riley certainly is. Now, some babies like to wave their arms around quite a lot during feeding, and if you find this problematic or distracting, you can try wrapping your baby up just to keep the arms nice and safely down by their side. So what you mustn't do is panic if your baby pauses from time to time. This is very, very natural. If you find breastfeeding a bit uncomfortable, it might be because of your position or because your baby is not latching on properly. If it's your position, you can take the strain off using a V-shaped pillow to rest your baby on. There are a few different positions you can use when you're breastfeeding, and sometimes it takes a while to discover the best one that suits you both. Of course, sometimes your baby decides what the best position is. If you think that your baby's not latching on properly, you can take them away from your breast and try latching them on again. If this doesn't solve the problem, then talk to your health visitor or visit the Cow and Gate website for more information on solving breastfeeding problems and some helpful hints.